Good afternoon. Welcome to the Black Equity Coalition presentation. We are excited to share the work that this group has been pioneering for the past 46 weeks. Our work has taken on a multitude of challenges as a result of COVID. As many of you guys know, COVID has transformed the way we live, work, and play. It's required many of us in the field to become more agile and iterative, looking towards collaborations and innovation to transform the way we do our jobs, the way we live, the work we think, the way we think. For the next 29 years, we believe that we have some critical flashpoints we need to be concerned about. The potential moratorium on rental and mortgages going away, the ongoing political divisions and armed civil unrest, the impact of COVID and its logical recovery plan and initiatives, what might make the role of racial equity more feasible and applicable, how we deal with income inequality, the role of artificial intelligence and robotics and machine learning, how we have to deal with the potential collapse of Medicare, what are we doing to really impact climate change and its impacts, how are we building bridges with the minority shift from the minority population becoming the majority in 2040, and most importantly, by 2050, how are we addressing 70% of the world's population moving into the urban corridor? These shifts require us to reimagine our work. We have moved from systems change to ecosystems co-creation, and let me explain that. Over the past 36 months, the Forbes Funds has optimized its systems change work to create a new paradigm by which we make our grant making. We have shown an increase in our grant making by 400% through this methodology. Notwithstanding, what we haven't shown was an increase in professional acumen, leadership, and collaboration. We have shifted as a result of this learning to adopt the framework of ecosystems co-creation, meaning that we optimize human beings as the most valuable asset in our ecosystem with the notion that those human beings will be able to transform their work in a way that has a triple bottom line. This is no more evident in what you're about to hear today. The group of a cross-sectoral set of stakeholders who never worked together for the past 46 weeks have endeavored, free of charge, committed to this great, impossible task of addressing the disproportionate impact of people of color, addressing the COVID-19 influence on our lives. This coalition has come together to create a multi-sectoral approach that looks like exploration of how we use our mind energy, our thought professional capacities to link services that heretofore have not been linked in a way that optimizes our gift, skills, and talents. This group is comprised of a thought leadership group called the Huddle. We are informed by a data group that provides data to us on a daily basis. We have a community health component that deals with testing and vaccination. We have a community engagement group that deals with our messaging and how we engage people. We've authorized a statewide coalition to share the learning across the state. We work collectively with the Black businesses to be in alignment with their needs, as well as provide support to their systems. We look at policies that are applicable to our core work, and we look at the role of education as a constant mechanism to increase our well-being. To create local to regional framework, statewide framework, we looked at the notion of human-centered design. We have been working for the past several months with Headstorm to create a new human-centered design framework that allows us to move from systems change to ecosystems co-creation and looking at the role of federally qualified health centers to really provide a hub and spoke model. This work has allowed us to pioneer how we use and develop a virtual research lab that really brings a framework to how we deal with what we think are the longitudinal impacts of our work. COVID is the tip of the spear. How we go about preserving humanity is about a longitudinal framework. And so this work is driven by another piece of our work called the Commons, which is about deliberative democracy. It's about how we educate, inform, and empower people to be transformed by their lived experiences and how they share those experiences across the region and the state. As a request from Dr. Levine a few weeks ago, we're working on a statewide opportunity to share our practices in a way that helps galvanize the sector in response to people of color issues. This framework will focus on the distribution of the vaccine, but also encompass how we mitigate risk long-term through a continuity of care approach. When you look at these numbers and you look at the people of color across the region, they really magnify our work and the numbers of places we need to dig deeper and create more sustainable relationships that move from transactional to transformational. In many of our daily vocations, we do things as a result of our business practice, the protocol. However, this group has moved beyond that to really create deeper relationships that allow us to dig much deeper into ways we can problem solve that exceed most of our professional understandings because of our particular acumens. This work is about looking at our state as one whole ecosystem and how we look at sharing our emerging practices and just practices in a way to flatten the curves as a systemic response to this social phenomenon. When we look at the statewide approach, we're looking at regions 1, 2, and 3 as more immediate people of color communities, and then our statewide regions in which we look at 4, 5, 6, 7, 8, and respectfully work collaboratively with 9. Philadelphia is a much more robust ecosystem and has a set of its own practices, which we check in with them from time to time to discern how might we partner and collaborate strategically. Our regions are really about how we look at scans and look at each level within the region, how we identify assets, looking at unifying North Stars, looking at how we create a hub and spoke model, looking at this notion which we'll be launching in this model, a health quality community cohort approach, which really looks at identifying pillar organizations within each community that are emerging organizations that have the ability to collaborate and bring cross-sectoral leaders to the table. This work will allow us to grow exponentially as a result of a transformational model that grows the sector through the continuity of care approach. When I refer to continuity of care approach, we're referring to the optimization of FQHC's federal qualified health centers as local trusted stakeholders, while concurrently looking at nonprofits who may exist within that ecosystem to provide wraparound services to create a way that we ensure the integrity of families. For example, in the city of Pittsburgh, in the east end of Pittsburgh, 76% of the households are headed by single women with children. And so our goal there is to ensure that if any mother gets COVID, that there will be existing services to mitigate her family's disruption by supporting her proactively during her COVID bout and reacting to it as a result of her post-COVID treatment and support. We believe that this work is best pioneered through a dual framework where we optimize the social determinants of health and the SDGs, the Sustainable Development Goals, as a two-tiered platform to look at our inputs and outputs. Our outputs align with the city of Pittsburgh becoming the second US city to adopt the SDGs as a global indicator of our work. Ultimately, how do we manage to measure? When we look at our work in identifying resources, we know that we want to explore the existing resources so that we don't duplicate efforts. But ultimately, how do we fast track and support resources needed within these communities to ramp up and what we call rapid prototyping? This is most important when we think about most systems are built on waterfall approaches as a leadership continuum. And so when we think about this COVID-19 Equity Coalition, its roots are very unique. 46 weeks ago, the PBOC, which is a group of Black professional politicians, approached us and asked for support to ensure that people of color were being tested at an appropriate rate. I live in Highland Park, and when this first started, I recall looking at the data, and I believe there were 152 tests in Highland Park and 19 in Larmer. And I immediately felt concerned about that analysis because I knew that many of the people in Highland Park were sheltering in place and did not have to go to work. Well, I knew that many of the people in Larmer worked at Giant Eagles, Trader Joe's, Target, CVS, and they had to go to work. And so I was concerned about the disproportionate analysis. And so I threw my hat in the ring and I asked some other stakeholders who are on this call to participate in a series of meetings to really work collaboratively with the county and the city in a coordinated way to really bring together the gifts, skills, and talents of people of color, which we knew needed to take place given the historical framework of how people of color felt about medicine. You guys know about the Tuskegee experiment. You know about the current challenges happening in hospitals. You know about the current practices being done in prisons. All of these practices have bestowed a level of distrust for people of color with the system, and particularly those driven by governmental agencies. And so this COVID-19 task force was really brought to bear in a way to create a counter narrative and support system for the existing frameworks that allow for cultural competency application to what we thought would be a challenging opportunity. At the time of our initial meeting, our Black people or community residents were dying at 1.5 times our white counterparts. Today, it's almost at 3.0. And so we do know that there needs to be more aggressive intervention and prevention strategies, most of which have to do with communications and trusted stakeholders. And so this coalition has been represented in the city, the county, and the state in a way that really represents the efforts of this group and during a pandemic that's never been realized. And so we're truly astounded by that work. We also look at the Pittsburgh equity indicators as a way to really galvanize our work around not just what's happening with COVID, but the other comorbidity issues which contribute to the state of people of color in our region. And so when we look at this framework, the social determinants of health really create a way for us to galvanize our work in sectors and then explore the cross-pollination of that work within our ecosystem. And so when we think about economics, our work is aligned with the Marshall Plan for Middle America. We have a high regard and trust for Dr. Leslie Marshall and her team and their vision. We look at fostering innovation labs, which we're currently partnering with Penn State University to launch the Nittany AI project, which looks at what is the role of AI learning in the nonprofit sector. We looked at how we deepen and develop strategic collaborations and partnerships to address food needs and other needs, housing instability, and the immigrant populations as well. Education, we are working with the superintendent and other universities and institutions to create an education ecosystem where we start with the early childhood education process. We look at create more videos and linkages that really provide ways in which we enhance people of color's understanding of this issue, but also concurrently based upon the number of people unemployed, how do we use this opportunity to launch a two-generation approach, which we're currently doing in partnership with Penn State and the Community College of Allegheny County. We use the framework of the theory of change out of Harvard. If you increase adult capacities, you improve kid outcomes as one of our staples. We also look at this role of social and community context and look at civic participation, which is why the Commons is so critical. The Commons is a deliberative democracy tool that looks at community complexity. Its goal is to create ways in which community residents and stakeholders look at utilizing CBPR, community-based participatory research, as a mechanism to better understand what's happening at the community level. That group is then charged with creating a group of stakeholders that share interest in a particular problem. That group comes up with a series of ideas. Those ideas get tested, which we call kicking the tires. Those kick tire ideas or pilots are then shared with the group and it's voted upon through deliberative democracy. Then we track those decisions to look at how each of those decisions at the community level drove the identified change or did not, and who was responsible for that work. How could it be optimized? Does it need to be revisited? Can we pivot from it? We also look at incarceration and the roles that we play there. We've been working very deliberately with Richard Garland and his work to really look at how we create social cohesion. The other thing we did was we partnered with Nora Bateson out of Sweden, and we initially trained 30 people last year in warm data labs. And today, we've facilitated 21 two-hour People Need People workshops, which is a derivative of the warm data labs, but now is online. And this work has allowed us to have more deeper relationships with community residents and stakeholders and leaders during the first round of COVID to help us as a foundation and collaborative partner discern where there was greatest challenge to the sector and where there was greatest opportunity. We also, most importantly, which brings us to our work with the health and healthcare framework, how the Black Equity Coalition accessed the healthcare sector and primary care services to really create a paradigm shift in our work, and how we brought to bear a health literacy framework that looks at a cross-sectoral application to apply this work in a uniform way across our sector. You will hear more about that from our colleagues on this presentation, which I'm excited to work with. And then lastly, we're going to talk about neighborhood and the built environment. Last year, the city of Pittsburgh hosted the 10th annual Eco Districts Conference. It was one of the best conferences hosted. It was one of the most diverse conferences hosted. We really look at the built environment as a longitudinal activity that should align with the city of Pittsburgh's adoption of eco districts and the P4 standards out of the Hines Endowment, People, Planet, Place, and Performance. We believe that this kind of holistic approach will mitigate exposure to toxins through the built materials framework, will increase and enhance air quality, we'll look at the built environment and our ecological footprints, we'll look at how we access and create and address food deserts, how we look at equity and the quality of housing as a macro level opportunity that should be integrated across the sector. And so we play a critical role in that work as well, as I am a planning commissioner for the city of Pittsburgh, and I sit with other commissioners on a bi-weekly basis to improve housing and buildings in our city. And so this work culminates with the development of the Black Equity Coalition Statewide Research Lab. Our vision here is that we will create a lab that has a specific focus on people of color across the state. And as we explore and exhibit growth in certain areas and practices where we mitigate and flatten curves, we share those practices across the state so they can be replicated, and we can track that replication of that work to see how we do a uniform application to mitigate risk. COVID-19 task force is around equity, and we use every platform to create ways we inform, empower, and educate folks. These platforms really reflect today's culture, and it's really causing us to grow and be agile as a group of stakeholders. We have done many things in collaboration with other stakeholders, politicians. We meet on average with Dr. Levine on a monthly basis. We just started meeting with Dr. Bogan on a monthly basis. We provide flyers to community groups. We host meetings. And over the series of our time of existence, we provide feedback and technical assistance to institutions that inquire about specific areas of concerning health and well-being. These opportunities with our stakeholders has really provided a threshold for us to really ideate, to think collaboratively. I have to give Dr. Levine a shout out. She has been one of our foremost supporters of our work, one of the greatest collaborators and partners I've ever experienced in the last 38 years, in that she honors our work, she pushes and opens doors for us in a way that allows us to have a direct access to opportunities, and she sees us as thought partners and we see her as one. And so it really gave us a real sense of our value through this partnership with her and her team, in which we began to co-create with her team ways in which we can enhance this work across the state. This work is best focused on through a two-tiered framework, creating a local to global framework and platform that really gives us a way to measure our work, not just locally, but regionally, nationally, and globally. We think that this co-created regenerative framework creates new cultures that are regenerative in nature. And if we use Maslow's hierarchical needs, how do we ensure people arrive at self-actualization? What are the core competencies needed for everybody to strive towards that as a measurable outcome? Our partners are many. These are some of a few of our core partners that have been riding with us since the beginning of this journey. They represent a group of cross-sectoral stakeholders locally, regionally, globally, and nationally. And they really represent the heartbeat of our work. They're pulse of our work. They are thought partners and thought leaders, and they really represent ways in which we're demonstrating without resources how you galvanize people to work collaboratively. Thank you for your time regarding this initial presentation, and I will be turning this over, I believe, to our moderator.
Good morning, afternoon, everyone. I just want to introduce our panelists so that we can get started. Let's see. Sorry, this always seems to take an extra click beyond what you expect. And we are clicking. So our first panelist is Dr. Tiffany Gary-Webb. Dr. Tiffany Gary-Webb is currently an Associate Dean for Diversity and Inclusion and a tenured Associate Professor in the Departments of Epidemiology and Behavioral and Community Health Sciences at the University of Pittsburgh, Graduate School of Public Health. She's an accomplished researcher, and her current research agenda is working to understand the social and environmental determinants of chronic disease and implementing interventions to improve prevention and control. She is now expanding her national and international reach to work on larger structural issues that will affect the nation's progress towards understanding and eliminating health disparities. Dr. Tracy Conti is an assistant professor and executive vice chair in the Department of Family Medicine at UPMC. Oh, sorry, at the University of Pittsburgh School of Medicine, which is slightly different than UPMC, apologies. She also serves as the program director of UPMC McKeesport Family Medicine Residency and co-director of the University of Pittsburgh Family Medicine and Psychiatry Residency, Her clinical and advocacy interests include health disparities and healthcare delivery to underserved communities, medical education, and women's health. Fred Brown is president and CEO of the Forbes Funds, a philanthropic organization focused on strengthening the management capacity and impact of community nonprofits in the Pittsburgh area. Prior to that time, Mr. Brown served as the president and CEO of Homewood Children's Village, a nonprofit that takes a multi-generational approach to improving quality of life in Pittsburgh's Homewood neighborhood. Previously, he worked for the Kingsley Association, developing green and sustainable communities through holistic visioning, resident capacity building, community empowerment, macro planning, and sustainable redevelopment implementation. Mr. Brown has been a climate justice trainer, environmental justice leader, policy analyst, adjunct professor, dean of students, teacher, coach, mentor, certified juvenile justice trainer, certified conflict mediation and resolution trainer with Train the Trainer certifications, master consultant, supervisor, director, and executive director of nonprofit organizations in the Pittsburgh area and elsewhere since 1987. So now that we have met our panelists, we can begin our conversation. And so I'm going to start with the same question to everyone, which is, what made you decide to get involved in the Black Equity Coalition?
So I guess I can start because Fred talked a little bit about bringing together the elected officials. And in his process of bringing people together and having discussions about testing, he brought in some of us who were in public health and in medicine to bring some technical expertise to that conversation. But for myself, so Kelly just did my bio and she talked about me working in chronic disease. So I work in older adults and chronic disease epidemiology, trying to understand, behaviors and neighborhood factors. And so nothing close to infectious diseases. So when COVID hit, I'm an epidemiologist, but I'm a regular citizen, and I was watching everything that was happening, just like everyone else, and didn't feel that I had, specific expertise to offer. But it became known very quickly that there were going to be equity issues, particularly with reports coming out from all over the country, from Chicago, from Milwaukee, and so forth, saying that Blacks were disproportionately dying from COVID. And I was starting to get phone calls from friends and family saying, where can I get tested, and so forth. And so this chronic disease epidemiologist quickly became a COVID equity researcher, and we started working to understand a lot of these issues. And so really it was early on, it was probably about April that I started to get involved and have been, intimately involved ever since.
So I think I got into the BEC through the same lens of, it started out with testing. And I remember the very first meeting that I went to, and there were philanthropists there were scientists there were legislators there, all, people of color, passionate about ensuring that our communities of color were going to come out of this better than what we saw in the country. And just the energy around ensuring that we were going to do something to help our communities, I was sold from that. Also, my bio, I'm a family physician, and family physicians are uniquely tied to the community. It's one of the hallmarks of what we do. And we practice in the biopsychosocial model. I'm also an educator. And so the ability to be able to sit with this group of amazing, people from all over the Allegheny County, and to contribute to that, as well as to bring that back to the community that I serve, to ensure that the community that I served had access. It was kind of a no-brainer, and how could I not be involved? And then, I have to give a shout out to Fred, who's just an amazing leader, and to inspire you to go beyond where you think you can. I think in medicine, sometimes we often get stuck in our office or in that patient encounter. And it's so important to go beyond that, to have real health change. You heard Fred talk about that multi-sectoral approach, looking at neighborhoods. I can't really affect diabetes without looking at the food access of the folks that I serve, right? And this group really is taking that approach. And as we moved on, the reason why I stay is because a lot of the things that we are addressing, that we are talking about, are going to go beyond COVID. We often say that, COVID shined a light on health disparities, but that's not what started it, right? And so our approach is really what happens beyond COVID, and how can we make this lasting impact on communities of color, communities that, really are vulnerable. And so the resources that we have and the resources that we're gaining, and to be involved in this, not just in Allegheny County, but then across the state, is so inspiring. I can't help but not be a part of this.
I'm super excited by Dr. Conti and Dr. Gary-Webb's comments, because to be quite honest with everybody on this call, I had no idea we would be here 46 weeks later. When I got the call from the elected officials and I inquired about the meeting they had, and they didn't have doctors and they called me to fix it, I reached out to my friends and colleagues and said, hey, can we have a meeting with the public officials and make the case that we want more testing and we need a voice and we need a strategy? I thought that would be the end of it. I thought they would say yes, that makes sense. Let's partner. We got a vehicle. We, you know, when we didn't get that response, something else triggered in me. Okay, people are going to die if we don't do something. And so I was honored by the team's commitment to do something, because at this point, we don't know what's needed. We just are trying to make the case that the testing needs to be done differently given the disproportionate impact. And we need to have a strategy for dealing with people who we know are going to get it because they're essential workers. And I have to tell you that this group has helped me grow professionally and personally. We've become a family. Um, I mean, nobody's getting paid. You know, when we started this, I don't think we raised money until about 5 or 6 weeks ago, maybe 2 months ago. We really started getting money in for this, and not to the degree that we needed funded. And so we just have enough resources to keep the continuity of what we're doing going. But moreover, I got involved with this because originally the force funds focus on human services and community development seemed warranted. As we got deeper into it, I quickly discerned that I'm not a doctor, epidemiologist, epigeneticist, bioethicist. I'm none of those folks. And so I really um, gave deference to those colleagues, and to, I think, Dr. Gary-Webb's and Dr. Conti's analysis. None of us ever worked together. And so working together under this kind of stress and duress and having to make decisions in an agile, iterative way was a double challenge to this group, because we knew of each other, but we didn't know each other. And then when we finally took a step back and looked at the collective genius in the rooms or in the screens, it was overwhelming for some of us because we've never saw that much talent together at one time.
And I just want to add to that, because that speaks to, Fred, you didn't talk in your presentation about the number of people that we have involved in the coalition. So you talked a little bit about the working groups. So each of our working groups are led by people of color. We have lots of committee members, lots of allies who are working behind the scenes. The data group is one good example of that. So I mentioned that's my particular area of expertise. So we started trying to track the data, particularly for Allegheny County in the beginning, by race. And there were all kinds of challenges. You know, some entities weren't reporting race. Allegheny County Health Department in the beginning was not reporting data by race. So these data experts came together and started to work on these issues and started tracking the data. And now we have a website where we track it daily, where we, you know, push people to be transparent. We push, you know, folks to be accurate in reporting. So it's been a long process, but I'm saying that to say that there are over maybe 60 people who are in the data group on a weekly basis. 10 to 20 people meet twice a week. And so that's just the volume of collective effort, it just in one group. In the other groups, we have, you know, maybe Dr. Conti can talk about the community health group. There, you know, physicians and folks working on the front lines. We have Black business groups. So there are a lot of different entities coming together for this. We're kind of representing the core group of it, but there are a lot of folks behind the scenes.
Yeah, and I think so the community health group, that's a testament to the growth that, you know, the BEC and the vision that they have, because our group initially was just a testing strategy group. And, you know, had, you know, individuals who were a part of different organizations during testing. And one of our goals, and based on information from the data team and looking at where testing was occurring in Pittsburgh and who was doing the testing, and that really started out just with the main health systems. If you recall way back in April, March, you know, almost a year ago now. And there were only 3 main testing centers. And so when you think about our communities of color, access to testing was was nil. And so bringing together, people in the business community and that testing group, people from the FQHCs to be able to, and looking at the data that the data group had to say, okay, here where our community of a color are, here are the institutions that are actually in those communities. So if we put testing in the community, and that was based out of the federally qualified health centers, you'll create greater access. Well, with testing, we know that that's only one aspect of, COVID, and you need to figure out who's being exposed to those who are being tested positive. And so contact tracing became a part of that group. And with contact tracing, really pushing the need for folks in the community talking to other folks in the community on a culturally competent level. And that's the only way that you can get true contact tracing, when outside or people who feel that they are outsiders asking questions in the community. Sometimes you get barriers, and that has a risk of increasing cases. And so that was something that came with our group. And now vaccines, right? Those same strategies, trying to make sure that vaccine distribution is done on a community level so we can access. And so we're more than just a testing group, which means why we moved to community health. And so to have support from, this large group of individuals all bringing talents together to help communities of color and continue to help us grow is something that, is very unique and that I've never personally been a part of.
So the coalition's been going for, I believe we count every week. I think we're at about 46 weeks now. So what makes the coalition work, in everybody's opinion? And what has been most instrumental to the success of the coalition?
So I think for me, what makes the coalition work is that everyone's kind of combined desire to want to see our vulnerable communities thrive economically, thrive from an educational level, and especially from health. And we're, because everybody around you is so passionate in this work, it keeps you engaged, and even when you're tired. And we were just talking earlier about, this is day 6 of us seeing each other, but it's okay, right? Because you take that extra time because you see the results, you see the impact, and that just re-energizes you.
Yeah, I agree with that. I mean, the commitment of the group is just, phenomenal. And with this situation, with most of us working from home and being sheltered at home, it allowed us to, I think, especially in the beginning, come together and have the bandwidth to solve problems. So, just think about what your lives used to be like. People would be away and, at work and, traveling back and forth to work and going to activities. And with us being grounded at home and thinking about this problem, it allowed a lot of us, to come together where we wouldn't have been able to in the past. And what's been great for me is working across sectors. I tend to work with people in the health sector, and working with folks outside the sector has really pushed me to think differently. So, I'm an academic. Fred is always used in the term, we have to be agile and iterative. Well, we're academics, we're slow, we're thorough, but we're slow. So, the whole idea that something's happening on the ground, we have to figure out how to deal with it, think about it, sit down, how to deal. And then by the time you have thought about it, something's changed. And so, that whole dynamic, is a little new for us, but it's good because, there's real world impact. And I think we're influencing some of the folks in the other sector too, as well, to think a little differently about some of the problems. So it's just been overall, really positive experience.
I would add that the beauty of this group and how it functions is an agape love that we have for one another and for the greater good of our work serving humanity. I remember when I tried to step away from leading or supporting this group, and the group pulled me back in and was like, "Where are you going?" I was like, "Well, I'm not a doctor. Like, you guys are the doctors." And they were like, "No, you're not going anywhere." And it really was a reaffirming moment for me that leadership is not always about content expertise. It's about how you motivate and guide people. And they really have pushed me to look at my leadership across disciplines in ways I haven't ever considered. Also, I have a great deal of respect for everybody that we work with. And I said this to Dr. Conti, I think last week or the week before last, if it's okay if I tell her what to do. And she said, yeah, like, tell me, like, because we get to a point where it's a lot of theoretical stuff going on, but something got to happen. And now we're at a point where we got a clear line of sight of what that is, but can we put some things in motion? And I never want to assume because of everybody's schedule, they can just do things, but it's humbling to be in a room full of people who are smarter than you, more talented than you, and then you saying, well, can I ask you or can I direct you to do this because it will help us get down the road? Dr. Gary-Webb and I talk pretty much every day. I'm always bugging her about something. I know she's sick and tired of seeing me texting her, but I feel like she's my sister and I can bug her and tell her like when something's getting on my nerves or when we need something. She's my immediate thought partner about big ideas. When I'm thinking about something, we have to say to Dr. Levine or Dr. Bogan and politically, like one of the things I think this group is realizing is our work is not apolitical, it's politically centric. And so everything we say, everything we do, every action we take, every action we don't take has political ramifications. And I think our group has worked in so many different silos, they never experienced this level of recourse. When things happen, they recoil in such a way that you don't anticipate. Because if you're used to writing a document or a white paper, you're used to scrutiny. That's part of the domain. That's part of the work. But scrutiny in our field means you might not get funding if you piss somebody off or say the wrong thing. And so there's a real tightrope that we have to manage with regards to how do you play well with others when you don't agree with them? And when people are dying, how do you make things principled in a way that they become critically important to move on? And I think everybody on this team has brought that level of purpose, that level of commitment, that level of dexterity to the table that makes that part of it easy. And so I think, Dr. Conti just said this is our 6th day seeing each other. It don't feel like it's a heavy burden. It just feels like, oh, okay, we got more work to do. And so that piece is, it's not sustainable. So we do have to take a break. And I would say yesterday we did our second retreat. We had over 50 participants participate. And to Dr. Gary-Webb's point, we have over 100 people that have been committed to this work over the last 46 weeks. And so when we get half the people giving up 3 hours of their Friday for a retreat, that says something when nobody's getting paid. That says something when the focus is on projects. That says something when the resources we have are being garnered to coordinate and build new systems and tools to do our work better. And so I think it's just bigger than us. This notion of this thing being bigger than us is what drives us, in my opinion.
Excellent segue into my next question, which is how is the coalition balancing this immediate response to COVID with the broader range goals of eliminating racial inequities in the region?
Well, I think we just got to that point because, so much of what we had to do was reactive. So, with the testing and so forth, a plan went out. We had to, try to push for equitable testing and so forth. And so with the vaccine, we were trying to get ahead of it, right? So we tried to start working on how the data systems would work for the vaccine, start working on talking with our colleagues about what their plans were. So then we became a little bit more proactive. So I think, once we get the vaccine rollout in a smooth fashion, our group will be able to focus more on the social determinants of health that actually contributed to the COVID disparities and other disparities. So, we do have members of our group that are focusing more on housing, that are focusing on education, and so forth. But our immediate priority has been these COVID outcomes, and we are shifting to think more of the impacts of COVID and other health outcomes.
And I think part of the foundation to that is when we wanted to use the FQHCs as that testing center to connect them to care for testing, but also for longitudinal care. So educating patients who came for testing that this is a site that you can get care from, trying to connect the FQHCs to resources to help deal with the social determinants of health. And that was kind of that foreplanning planning into the future of this has to go beyond COVID. This has to go beyond, what this current is, and how do we plant those seeds to patients who are accessing this immediate need for testing to think about their long-term health goals.
I would say that this work helped to drive some of our other core work when you think about community context. And so I want to be clear that as we each speak, we're speaking concurrently in many ways. One, we're speaking about our specific work with the BEC from a medical perspective. And then secondarily, we're speaking around and directly to the other 4 social determinants of health that connect our work. And so when you ask the question around racial equity, 3 weeks ago, the Forbes Funds launched the International Anti-Racism Wireframe Cohort. We call it ARC for short. We had 158 members from around the world participate. And so we really have taken this notion of racial equity to a global level. We think that this global framework of our micro, meso, macro, and global work that's being demonstrated at this level is replicable. It's something that other people will look at and see the value in, and they will look at the cross-pollination of this work. And most importantly, they will see people of color driving this work with a level of professional acumen and outcomes and outputs that are worldly renowned and respected. And we think that we are past the point of acknowledging people of color can do great things. Where we're at now is that give us the space and deference to lead, because we do have answers. Give us the ability and resources to resolve social phenomena. We do have a cogent understanding of those issues, and respect us and honor us as human beings, because we're all part of one human race.
Do you have any suggestions or tips for anybody who's looking to sustain their movement work from responding to a particular crisis to building a coalition or something that will drive and last beyond that immediate response?
Fred, that's for you.
One of the questions, thank you, Kelly. I think that's a great question. I think one of the things we do every day, and Dr. Gary-Webb alluded to, I talked about being iterative and agile, is we scrub our decisions. Was that a transactional decision or transformational? What we try to do is increase our awareness that when we make a decision to do X, and X might have to happen, but underneath X, is there a sustainable relationship that could be garnered? Our core work at the Forbes Funds is to increase the effectiveness and efficiency of the nonprofit sector by reducing the duplication of effort and increasing our velocity and trajectory towards some common goals and objectives. This group has demonstrated at a much higher level the value of cross-sectoral collaborations, the value of divergent thinking. When you think about what Einstein alluded to, that you can't solve a problem with the same energy that created the problem, this group is demonstrating what collective genius looks like. And I would say that we started off with a very, what I would call a clear motto. When we met with Dr. Levine for the first time, and we told her, if this is just about COVID, we're having the wrong conversation. We want a statewide partnership with you to talk about the entire health equity of people of color for the state. COVID is the tip of the spear, but the comorbidity issues predate COVID, and they're going to exist after COVID. And so we need to be thinking longitudinally about that. And so for us, and for that question, Kelly, I think that if we can convince people that everything's connected and find the connected tissue of that, then we can demonstrate that our decision-making should not be transactional. It should be woven into a transformational response that's built on deepening relationships, not just the actual act, but the people who are making the decisions, and getting to know them on an interpersonal level will create intrapersonal opportunities for you to grow and sustain relationships that are being demonstrated on this summit. Like, this is intrapersonally connected and interpersonally connected.
So I'm going to start getting to some of the questions that were posed in the chat. The first one is from Kelly Henderson, which is, what an amazing relational effort. Given that you are 46 weeks in, are there ways folks on this call can still plug in if we need more people power for anything?
I don't think anybody's ever going to say don't join, right? We can use as much help as we can get. Kelly, I don't know if you can put the website on, because there's a way that you can connect to us through our website, and we can get your name and contact you to see where you want to be involved. But yes, the more people, the more mind power, the better this coalition works.
So I've dropped our website. Our Facebook was in the chat earlier. I'm going to resubmit that so it doesn't get lost, and also my email address. So if anyone wants to reach out, they can do so. And I was typing instead of reading the next question, which is from Isha or Asha, I'm sorry if I'm pronouncing your name wrong, who is wondering, given the political climate of Pennsylvania in the last few years, if we have faced any pushback in obtaining data or information, engaging in discourse, or pushing for outcomes.
Dr. Gary-Webb.
Yeah. So yeah, this is what we've been dealing with, unfortunately, with the last administration. So you know, the CDC has been, you know, kind of stifled in what they're able to do. There's been instances of epidemiologists fired all over the country for trying to put out, you know, accurate data. And, you know, again, locally, we just got a little bit of pushback in the beginning, because nobody wants to, some people don't want to admit the problem is as bad as it is, right? So putting out these numbers, we're just telling the truth. So during this whole piece of it, we have had to be very, very transparent about, you know, pushing people to be very transparent about the data. And that's been, you know, part of our role. At the, like Fred has said, at the state level with Dr. Levine, she has been very, very open to hearing our suggestions when we started talking about, you know, certain organizations and so forth that weren't collecting race and that weren't, you know, being transparent about reporting. She actually put out health advisories and so forth. So I just want to put out the message that the political climate is changing. You can already see those changes. New director of CDC, new plans. Dr. Fauci, I was watching NBC this morning, and he was saying, you know, he feels like he can finally just talk about science and talk about the truth. So there's a huge change happening now. And so I think, you know, we're going to see vaccine efforts ramp up and, you know, and science take over in this.
The next question is actually sort of two questions together, which is, what specific information can we share about eligibility to get the vaccine, the process of making appointments, and in FQHCs, and how that works, whether you're insured or not?
So for federally qualified health centers, you do not have to have insurance to have access to care. if you've been following kind of the vaccine rollout, you know that there was an initial plan and with different tiers, and then that kept getting updated. And so currently there is, you know, the plan out there that folks that initially started with healthcare workers, now that includes folks that are over 65 or between 16 and 64 with a chronic health condition. The issue is there is not enough vaccine in the state of Pennsylvania to be able to meet the demand of everybody that falls in 1A. At this point, one of the best things that you can do is on the health department website, there is kind of a vaccine kind of information center of where you can get vaccines. There are different clinics being set up, and the BEC is actually working on a vaccine distribution plan to ensure that vulnerable communities are included in this. Right now, though, there just isn't enough vaccine in our state to be able to vaccinate everybody in tier 1.
I mean, I'll just add that, you know, so in the next couple of weeks, this should get better. But there are lots of different places right now that you can try. So I just experienced this last week in trying to get my parents vaccinated and so forth. You know, so the Allegheny County Health Department is doing their own vaccines. So you check their website. They just put out last night that they are opening up to age 65, you know, because the state has opened up 1A. I heard their appointments were booked up in about 10 minutes. So, you know, ACHD is one, you know, checking your doctors. We're really hopeful that the pharmacies will get their doses in the next couple of weeks. So Giant Eagle and Rite Aid have all put out websites, but you will see in our area that they may say there's nothing available within 15 minutes. Sometimes, you know, I have family members who are willing to go to Westmoreland County to get it. So it's been a real process, even just trying to, you know, determine who has access. So, you know, I just say keep trying, and it will get better in the next couple of weeks as things open up.
Great. We have another question about addressing the mistrust and distrust of medicine among BIPOC communities that's rooted in generations of medical injustice in order to ensure that our most vulnerable communities are getting vaccinated despite hesitancy and generational trauma.
Tracy, do you, or
I was going to say who's going to take it. So
I can do something, but
yeah, so this is a real issue, and it's why we actually have that communications piece of the BEC to get a message out to communities and partner with communities to be able to address the mistrust around the vaccine and have trusted partners. On our retreat yesterday, actually the lead for communications, you know, asked, you know, people on that call in the BEC who has gotten the vaccine, and can you do a short video, a testimony, so that we can get that information out. You know, I feel that the more communities of color hear from healthcare workers of color, other communities of color who have gotten the vaccine, who can talk about the vaccine and really address the mistrust issues centering around the historical systemic deficiencies of our country. That's how we get that, you know, message out there. And so we do have a group that's specifically addressing communications to our community around testing, around vaccine, around just COVID recommendations in general.
Yeah, that, I mean, and so I'll just add that, you know, and it's important. So not only just, you know, people who have been vaccinated, but to understand there have been Black people behind the scenes. Dr. Kizzy Corbett is one of the developers of the vaccine who works at the National Institutes of Health. There are some other you know, persons of color working at the pharmaceutical companies, really having the conversations about, you know, the details of the vaccine and the testing, and, you know, putting out the message that even though it was a quick process, corners were not cut with that process. There was lots of money that was invested so that it could go a little quicker. The technology for the vaccine had already been tested in other, diseases and other forms. And so, all of these, we plan on having lots of community conversations. We have a speakers bureaus that is actually going to different community forums to talk about this. We have the Gateway Medical Society, who has the Ask a Black Doctor, where there's forums for people to discuss this. So we're going to continue to provide opportunities to be able to discuss, acknowledge the historical issues, and understand why people are hesitant, but then talk about the current situation and where we are, and the safety and efficacy of this vaccine.
I would also say that our messaging has been about creating concurrent messaging or dual messaging. One is, we know that there are some people that just do not trust the system. And so we don't want to convince you to do something you don't want to do, but if you're not going to take and get the vaccination, will you do the 3 W's? Watch your distancing, wear a mask, and wash your hands religiously. Not sometimes, not when you feel like it, not when you think about it, but it has to become a second part of your human nature for the next few years, right? At least for the next 18 months. We're not going to get to herd immunity until we get to over, I think, 75% of America being vaccinated. Well, we already know that 1/3 of America said they're not getting it. And that number even looks different for people of color. And so we are working religiously with sharing and blogging. Like, some of our docs and people on our team have gotten the vaccination. They videotaped it. We're asking them to blog every day. We're asking them to tell honestly how they're feeling, if, besides my arm being sore, or there any other side effects. And we want people to be informed decision makers. We also want people who say, I'm not taking it. And there's some docs that said people with different medical conditions should hesitate. They should think about other things. And so I'm not a doctor, I'm listening to other doctors, and I'm saying, okay, well, if they're not going to take it and you're saying not to take it, what are you telling them to do? And so how are we ensuring that we're giving people the right responses or the appropriate responses, given that there's one camp that is looking to take the vaccination, another not, and then there's a group on the fence. I'm not sure if I'm going to take it. I'm not sure. And so we know that having communications with these groups do a lot of that. I'm very impressed. I did a site visit last week with a group of people being led by Rebecca Gilmore and Homewood and her team, who have done some fantastic work around the flu vaccination and done some initial analysis on people willing to get this vaccination based upon the relationships they've built around the flu vaccination. And so we will be optimizing that framework in our work moving forward. And, it's a simple process. These decisions are being made because people trust people, not because somebody told them you need to get the shot. They're being made because somebody that comes to see them every week, feeds them, gives them extra food, checks on them and saying, I'm getting the shot, or I got the shot. So it's not just seeing people of color get the shot. It's the trusted relationships that really go over and above and beyond to really get people to take that next step.
Okay, so I'm going to ask one more question, and then anybody who would like to ask a question can unmute themselves and ask in person instead of through the chat. So the next one is from Henry Dragonflow, which is, oh, it moved because somebody typed something else. Sorry, lost it. Which is about recognizing that comprehensive health will be an ongoing issue even beyond the current situation with COVID. Does the BEC have hopes to expand to other areas like education and literacy or workforce development?
Is that a me question?
Yes.
That's a great question. And as I presented earlier, that's why we adopted the social determinants of health as our core construct. And if you heard Dr. Gary-Webb and Dr. Conti and Kelly talk about our other partners who are doing work in workforce development, housing, minority businesses, small businesses, They're all part of this coalition. We meet with them on a weekly basis. Most of us have at least 2 BEC kind of meetings a day on a minimum basis. And what that does is it builds continuity for us to understand. For example, we were interested in Dr. Levine's response to the moratorium on housing. And there was a metrics that was created that I think, was it for every 65 people who would be homeless, there would be a medical condition? I don't know. I can't
There's
remember that.
one COVID-related death in the community for every 60 evictions.
Thank you. I knew it was 60 something. Thank you, Kelly. So for every 60 conviction, there would be one COVID-related death. And she brought that up, and we asked her to carry that. And so this is our point. Like, COVID is not just the medical condition and the virus, it's the lived environment, it's the healthcare that you have, it's the food that you're eating, it's the number of times you have to go out and get things, it's the built environment in which you live in, it's your overexposure. I mean, one of our key thought partners and leaders in this work, Dr. Masuro, talks about sentinel surveillance, wastewater sentinel surveillance. We have to use technology to help people understand that even though you might be asymptomatic, you're positive. Even though you might think you're okay, you might have issues. Even though the people around you have already gotten sick, we don't know what the recourse is if you can get it again. We don't have enough data that says that if this happens, then that. And so we are working across those sectors to really enlighten them as to what we know when we know it, and using that to build a continuity of care model that looks at health and well-being beyond the healthcare sector, but looks at economic stability, housing, community context, policies. And that's why this thing is so massive, right? It's not just about the vaccination. It's not just about COVID by itself. COVID is really, what COVID has done, in essence, we knew that racism was an issue. It was the tip of the iceberg. We all walked around it, we saw it, some of us climbed up it, we put a flag on top. But what COVID did was it made the waters recede to see how big the iceberg was and what the other comorbidities situations are, and stuff people don't pay attention to that now cannot be ignored. And all we're doing is stringing together those activities and saying, there is a way to do this comprehensively and strategically and minimize the duplication of effort and increase your effectiveness and efficiency. And what you're hearing is a group of people who have done that.
If anyone has a question that they would like to ask verbally, you can do so now. We also have in the chat the announcement of Dr. Conti that she has received her vaccine. If anybody has any questions related to her experience specifically, I'm sure she'd be happy to field a few.
And I can just tell you, so I know there's hesitancy about the vaccine and, people feel like it was rushed. So just to reiterate, so this vaccine is an mRNA vaccine. It does not inject live virus into your body. It actually has codes in it to replicate the protein on the spike portion of the coronavirus. They have been doing mRNA vaccine research for multiple years. And while this vaccine seems like it was quick, the baseline research for it had already been done. But what got it to market is because some of the regulations and red tape and an enormous amount of money was poured into multiple people working on this vaccine. When you put a lot of money on something and contribute in that manner, you are going to get results. And that's what happened. And so while I think the political aspects of it and the media aspects of it made it seem like it just came out of the blue, it did not come out of the blue. So I got the Pfizer vaccine, which is the one that you have to keep at really cold temperatures. My first shot, I just had regular arm soreness, no different than when I get my flu shots, anything like that. I took Tylenol, I was fine. I got my second shot 3 weeks after that. So the Pfizer is a 3-week interval. Initially just had, the same sore arm, but that night I got chills. And as a physician, you always think you know what things are until it happens to you. And so I had never really had chills before, even though I thought I did. And so it was almost to the point of where I didn't have a fever or anything, but I just could not get warm and was shaking. That lasted, for maybe about 5 hours. And most of that was during the night. I woke up in the middle of the night because I had tons of blankets on me. And I was like, oh my goodness, I can get all this stuff off. And the next day it was just the arm soreness. I know, most commonly, or the arm soreness, fatigue has been a big common complaint. The chills have been a common complaint, and some people get fever. Really no different than any other vaccine and side effects that are out there.
Anybody else? I did list all of our committees in the chat because that was kind of gone over fairly quickly in the presentation. So that's data, community health, Black business support, policy, community engagement, the statewide coalition, and education. So those are the different fronts that we're pushing on. So there was a question about any specific policies that we were advocating for that we could use some help on. And so just giving people a better idea of all the various fronts. So if anybody has any questions related to any of those specifically, or if they have interest in any of those specifically, they can also reach out on those points. We've answered every question that anybody has. We're just that good.
No, Kelly, I'm sorry. My name's Dana. I'm a community organizer with Just Harvest. I was having technical problems in the very beginning, so I missed that, the first part of the presentation with the working groups. Where did you just post those?
Those are in the chat.
Okay. And so these are places that other groups would be able to plug in and learn about the work that you're doing and look for crossovers?
Yes, so we could connect you to the chair. Each committee has a lead or a pair of leads, and we can connect you with them to see how we can go about integrating work and pushing together.
Wonderful, thank you.
No problem. Also in the chat is a link to the feedback session, feedback for the session. So you can please fill that out. That would be helpful to both us and the organizers going forward. So that will bring me to my last question. Oh, go ahead.
A quick question, Kelly. Unfortunately, I've been out for an hour or so. My computer went out and I had to drive to the Hill District to my office to get back on. So I wanted to catch this whole panel. Fred knows we've been interacting with folks on this issue, and I'm so glad that you all were doing this panel. I wonder, is there a way that you all could summarize what happened today in your session, that it could be marketed out to the community? Because even though I only heard a little bit, I can tell that you were projecting some valuable information. And one of the concerns that I had was that Black folks freak out on the history of what white folks have done to us at times, but this is not one of those times. We need to take care of ourselves as in any way possible, because we're the ones being affected 2 to 3 times more than anybody else. So is that workable or expected or already committed to do, or what?
Well,
Sounds like a Fred question.
I think this is being recorded, but I do think that our communications and community engagement team are working continuously around the clock on messaging, on short videos and such. If there's something specific that you want us to put together that encapsulates what we talked about, we can work on that. This thing is moving at such a hectic pace. Sure. We find ourselves making constant pivots to be viable in the sector, but we do know that a strong source of messaging needs to be created, one that we think encompasses both those who want to take the test and those who are hesitant about taking the test, and really coming down on both sides of that equation with a logical and pragmatic response, because we're over 400,000 people that have suffered. That is a result of this particular pandemic. And we have to be honest, none of us woke up 10 months ago thinking we was gonna have to figure out a pandemic. And so for people to think we have an answer for this is not, it's not logical to me. I'm not that smart, but it just don't seem logical to me that you can beat people up for not having answers, you know, to a pandemic. But I do think we got to take responsibility for being open and transparent and being accountable. And I do think that there's a dichotomy, there's a lack of consistency there. And I think Dr. Gary-Webb alluded to that in her presentation when she talked about the data is telling us a story. We're not making it up. And so when we put the data out, it's not to berate anybody or any system or anything. It's to say, we as people of color see a disproportionate impact in our community. We think we have some ideas to mitigate that risk. Will you work with us so that we can save people's lives? It's a simple equation. Like, we ain't trying to say you terrible or you don't know your job or anything like that. But we are saying you're not Black. We are saying that. And we're saying that people of color got a different set of experiences that you need to honor, and that we bring a different resolve to dealing with those issues. And to your point, Tim, we need to also be able to convey that to our colleagues and our friends and family members, which I don't know if you missed this part, but we don't think we arrived there by a bulletin or a commercial. It's by relationships.
Sure.
So we are building those relationships every day in a deepening way. I do site visits almost every day, but I get out every day just to let people know, I see you, I appreciate what you're doing. What do you need from us to be more effective and efficient?
Is it workable to put, we would certainly do this on our BPEP media site with Calix DeRoche, our new young person who's been working on expanding our media presence in social media presence, to have something that various organizations could put up on their website so you can't miss it. It's the Urban League, it's NACP, it's APA, it's CEA, whatever. It's all over the place. What do you think?
Yes, I mean, Tim, we don't want to recreate the wheel. We want to help grease the path.
That's right.
So if there's a way for us to strategically work with you, if there's a set of specific messaging you would like us to create, and that's not just for you, that's for anybody. Sure. Let us know what that is and we can do that. We are working.
Let me clarify. I meant the message that you all have created today, which is an alignment.
I don't know how we distill that down into a short, I mean, I'm quite sure it's possible. Somebody will have to get control of the recording and edit it, but I'm quite sure that's possible. Yes.
What I meant was you all would send that out to different organizations who'd be willing to put it up on their websites to share the message. So more entities are marketing the message that you have already created.
So Tim, we have some materials that we're working on that tell the story, the origin story of the BEC. Sure. And where we are. Okay. We also have a toolkit that has specific messaging on mask wearing or vaccinations or any of the other points that we've gone over. And okay. We have the ability to have that co-branded so that you can put your BPEP logo on it with us and push it out. And if anybody who's interested in taking advantage and utilizing that media toolkit, please email me. I just put it in the chat. It's Kelly with an IE at forbesfunds.org, and we can get you connected and get those over to you so you can just plug and play. Actually, I could do it for you. I still have your logo on my hard drive.
There you go. There you go.
But yeah, so like we can plug and play and get that out so you can distribute it. But that is something that we've been working on that we actually just unveiled at our retreat yesterday. So excellent. Everybody, please feel free to reach out. Again,
everybody can market that, and it's already we don't, like we said, Fred, you saw that in my email the other day. We don't need to create wheels that already exist. Let's grease the ones that, because you all are greasing it, so we're gonna grease it some more. And good to see you landing at the Forbes Fund, by the way, on a personal note.
Thank you.
And the moderator also put The moderator also put in the chat that this session will be put on a YouTube channel so that, you know, others will be able to at least see this session as well.
And they're going to send it to us, so it'll be on our website and on our Facebook page as well. So it'll be available. At 6 minutes, if anybody else has any pressing questions. for the
Maybe
group.
organizations can put that on their website too, that, or access to it or link or whatever.
Absolutely.
Congratulations on the work you do. It's good.
There's a question, Kelly, I don't know if you saw it from Hillary about messaging for other healthcare workers who are not Black. How can they help tailor that message to their Black patients?
Let's connect, Hillary, about on that. Some of our messaging, we could probably would still work. I know, like, you know, multicultural imaging and messaging is still helpful, and so that might be something that you could take advantage of. So let's talk, Hillary, and see what we have in our toolkit that might be able to meet your needs.
Well, this is the first time we got out of a session without questions all the way to the end. This is I don't know if we did a good job or not. I don't know, Dr. Gary-Webb and Dr. Conte. Maybe we fumbled the ball.
I have a quick question. I have a lot of questions actually, but I'm wondering, so it still feels like there's this narrative out there that racial disparities are somehow biological and inherent to our Black and underserved populations, as opposed to a result of social determinants of health. And I'm wondering if you, and I still feel like that's part of a discussion or part of the narrative. And I'm wondering if there's data I can point to when I'm having conversations with people that really clearly indicates or suggests that those things aren't true.
Yeah, so I mean, it's from my perspective. So in the academic world, especially in medicine, definitely in public health, there is still the biological and genetic kind of thought. And so in public health, we have brought a lot of the social determinants language, into that discussion. So from where I sit in the academic space, there is this shift happening in the world because COVID is something that everyone was paying attention to. So I've been studying social determinants of other conditions, but not everybody in the world is tuned into that, right? But now with COVID, everybody is tuned into why, African Americans would have or other people of color too, have higher rates. And they have pointed to, overcrowding and poverty and testing and housing. And so I feel like there's a lot more awareness out there. So, I don't know if other people can speak about their settings as to that. I can say that conversation within our academic setting is really evolving. And so, there are all kinds of articles coming out in the New England Journal of Medicine and in, JAMA talking about racism in medicine, talking about these biological, thought processes. Even we had a discussion in our epidemiology faculty meeting about race-based corrections that we've been using in medicine. So we use race-based formulas for kidney disease, for diabetes risk. We use all of these different race-based formulas and even starting to think differently about should we be doing that or not. So I think there's been a lot more discussion. Can you say a little bit more about setting where you think there's still kind of the biological determinants?
I mean, I totally agree that I think in the medical setting is where we talk about it the most. So I think that's where I'm thinking about. And I'm thinking about in media too. I think when I'm thinking about the early conversations about disparities, there was just less attention to it. I agree. I'm really encouraged to see some of those conversations evolving in like the academic medical spaces. And I think it's not quite, unfortunately, like I'm thrilled to see it happening there. I don't think I'm seeing it kind of percolate down into media or into the larger conversation. And so I'm hoping and wondering, like, as we get more information and more data, that maybe we'll start to see that evolve and become a bigger part of the conversation.
I do think, to add on to your concern, that the city of Pittsburgh and Allegheny County recently adopted racism as a public health issue, and we have asked the governor to do so as well. And if you look across the country, there's a number of states and mayors and cities that have adopted racism as a public health issue. I think once that becomes locked into their ecosystem, then more resources will be allocated to addressing and deconstructing those issues. There's blind spots, historical practices, implicit bias. I mean, there's a lot of folks walking around and think that they're not doing racist activity just because they're not saying bad things and in their mind not doing bad things. But if they're upholding systems that continue to be disproportionately discriminatory towards other people, and because they don't see it, doesn't mean it's not happening. I mean, just look at what happened a couple of weeks ago when the mob rushed into our political system. How that mob got treated is a direct reflection of the same police departments that when Black Lives Matter marched, it was a totally different response. And if white America and other people don't see that discrepancy, then you can't even begin to understand the discrepancy that's happening in medicine. It's happening at every level of our ecosystem. And what we're saying is, we're not going to change that overnight, but give us, support us, empower us to do the things that are in our best interest through our lens in partnership with you. This is not, it's not about you. It's just about us taking care of us. And we think we know how to do that pretty well. And so that doesn't mean you're excluded. It just means that instead of you driving the car, you might need to be in the passenger seat. We're not saying you got to get out the car, but we need to know we need to do the driving. We need to, work with you on, why we're taking this detour, because we have a different understanding of the problem. And for whatever reason, that makes people uncomfortable. And for the life of me, I don't get it. I don't get, I could never go to Squirrel Hill and tell Jewish people how to do bar mitzvahs. They wouldn't accept my analysis of why I think they should do it differently. And so I don't understand why people think they can tell people of color how to live their lives and what they need to do, in particular when we're done disproportionately. And I want to also dismiss this notion that we don't care and we deserve this because we're out of shape. We don't have good health practices and we're eating sugar. Well, if you're living in a community without a grocery store, if there's a food desert, if your community's been disinvested in for 40 years, I find it very difficult for people to have a strong opinion about the health and well-being of a community. When you're looking at communities that Homewood had 30,000 people in it in the 1930s and 40s, there's 6,442 people in Homewood today. Larmer had 13,350 people in the 1930s and 40s. There's 1,700 people in Larmer today. Those two communities have been disinvested in. They didn't just go under, they've been disinvested in. And so let's be honest about how we find ourselves in these circumstances and conditions. And we're not blaming anybody because 40 years ago, you weren't the person that disinvested in them, but you inherited that. And what are you going to do differently to ensure the integrity that everybody has a humane pathway to their health and well-being? That's a human right.
Amen.
I'm gonna pass the pulpit. I'm gonna pass the plate in a minute. So we gotta do a fundraiser for BEC.
I'm sorry to interrupt, but I just want to tell you that your words have just blessed me so much today. I'm an organizer, and these are tough times for us all. And to hear you coming with such purpose and true deserved righteousness in your path, it's just really inspired me and given me a lot of hope to be able to collaborate with individuals and groups like yourself moving forward to address some of these needs. So thank you from the bottom of my heart.
Thank you.
Thank you very much.
Dr. Gary-Webb would always, what do you call those, conspirators?
Yeah, co-conspirators, accomplices, allies, we have a lot of different, terms.
We would be remiss to sit here and say we're doing this all by ourselves. We are not. We have co-conspirators, conveners, coordinators, and supporters of all different races, ethnicity, gender dynamics, and social economic strata. Why this works is because each one of them honor our leadership. And when we ask them to do something, this is the first time in my 38 years of doing this work that somebody white didn't question when I asked them to do something. And I've been leading organizations for a long time. In my job I have now, I had white people question my leadership and ask me who was I to do stuff. And I was like, well, I think I'm the CEO. I mean, I think I'm allowed to make this decision. I mean, there is an implicit bias that people have that I don't even think they're conscious of, where they don't even give deference to the position. They say, well, that is the boss, so maybe I shouldn't say that. Their privilege just lets them say anything. And I'm just like, wow. Like, I think I signed checks around here last time I checked. I think you might want to be cautious about what you say and how you say it, just because I seem like a free and easygoing, groovy guy, and I might want to go skiing with you or rafting, doesn't mean I still don't get to make decisions in this institution, and that they didn't hire me to do such. And so I do love this group because the people who are co-conspirators with us, they don't challenge us. They actually say, I didn't think about solving problems that way. That's a new way for me to think about stuff. And to me, that's the beauty of this group being able to lead without hesitation or mental reservation, is that we're doing it in such a way that people get with us and they go, like, that makes sense. Even though I don't understand everything, I'm on board. And once they take the journey with us, they begin to see a different context for problem solving, which is why this group, I think, to Dr. Conti's perspective, why every time we get together, we don't have a lag. People aren't dragging. They're like, what's happening? We're tired, but what's next?
Great. We are over time.
Oh,
That's okay. We were under and then we were over because
Yeah.
they had a question.
That's our usual practice, so I feel better now.
But we're not doing too bad. We're 6 minutes over. I just want to be respectful of everybody's time and wind it to a close. I'm going to go ahead and put our web address in here again so that nobody has to search. And we look forward to connecting with all interested folks going forward. Thank you.
Thank you for having us. We're so excited to be here.
Thank everybody for, attending this and especially for your questions. We really, really appreciate that.
Thanks for being part of the Black and White Reunion Racial Justice Summit. This was a powerful session. Even though I only saw part of it, I got it. Thanks so much.
Thank
Wisdom
you.
has been shared.
Thank you so much. Really appreciate your work.